Well, pregnancy is usually a special time full of excitement and anticipation, but for expectant mothers facing the outbreak of the coronavirus disease, this can be a very stressful time. For more on this, we're joined via Skype by Dr. Shastra Bhoora, head of COVID team for Obstetrics and Gynecology at the Charlotte Maxeke Hospital here in Johannesburg. A very good afternoon to you, Doctor. Thank you so very much for joining us here on SABC News.
Thank you, Flo, for having me.
You know, we had heard reports that after the announcement of that first lockdown, that pregnant women were not going to hospitals for their regular checkups. And of course, one can understand, given the circumstances, why, you know, they would choose to sort of stay away. What is the situation now? And are expectant mothers starting to sort of come more often to hospital for their checkups? What are you seeing?
So I think initially you're absolutely correct. With the beginning of the lockdown, we did see maybe in the first 2 weeks, fewer patients attending the hospital from a routine checkup point of view. However, the emergencies as well as those acute cases that needed acute care did come in on a regular basis, as the emergency department has been open and prioritized in terms of advocating to safe mother and child practice. The eventuality of patients reporting to the hospital then started to pick up after the first 2 weeks after the lockdown. And we noted that a lot of patients actually really did value what the healthcare system was offering to them. And they looked for guidance from us as healthcare workers and from a maternity care unit to basically facilitate and guide them in terms of when it was safe for them to come to the hospital. Saw this before the lockdown was announced and became official, and started contingency plans so that we would be able to protect our pregnant population, as well as to be able to protect the communities that they were going back to. So what we had envisaged in the beginning was for routine cases, try and space out visits, utilize good hand sanitation etiquette, encourage the use of masks as well as social distancing in our clinics, and basically spaced out visits slightly longer than you would sans the pandemic, to facilitate that every patient was safe when they came to the hospital for care, and that when she left the hospital, she continued in a safe environment when she went back home.
Doctor, two questions here. One, have you had to deal with a expectant mother who perhaps is COVID-19 positive? That's the first part of the question. And when we are talking about a mother a pregnant woman who is COVID-19, who is coronavirus positive, what should be taken into account when dealing with that? What does coronavirus then mean for an expectant woman?
So the first thing that sets in when we find out a result or when we disclose the status to a mom is panic.
Yeah.
It's the fear that it could be some form of transmission to the baby. We don't know how the mom is going to respond to the virus, what her immunity background and her, organ system function would be like within the virus. So that needs to be dissipated in the sense that we know that pregnant mothers during this pandemic have not had a worse outcome during the corona pandemic as previous pandemics, where pregnancy was seen as a massive, huge risk factor. So to approach this would be to be able to introduce that we do have the situation under control, that we are aware of all the contingencies that need to be put into place for her safe delivery and to limit any form of transmission to her newborn baby. So I think that would be very important.
Yeah.
The two components that we have here are protecting the pregnant mom as a unit, the mom who is laboring as well as the newborn baby. And the second component will be protecting the healthcare worker from barrier precautions. We've developed quite a unique and a very well worked out plan in our COVID ward for a delivery suite that incorporates the pregnant mom to be in a private space to have the support that she needs, and that the baby is kept in a very comfortable resuscitation and warm area once delivered for facilitation of immunizations and for examination after the delivery, which keeps the unit together, making sure the mom doesn't feel isolated and knowing that she's got the support of the healthcare worker team to go through the process of the birthing delivery.
And just in reference to my initial question then, have you had any kinds of cases like that where you've had a mother or a pregnant woman who was indeed positive for COVID-19, or are you not able to divulge?
So we have had experience with positive cases. We have facilitated a testing system so that any patients who are admitted to us, we do know their status. And this assists us in terms of protecting patients as well as the birthing mom for her delivery and the newborn baby. And this way we can try and facilitate to see what is needed for each delivery for best practice medicine. We have birthed and we've delivered a few positive mums in terms of the COVID disease, with great outcomes for both baby and mom. And if we review even further, many of those babies have ongoing to be negative. I'm not sure what the future may hold for them, but these moms are extremely diligent. They've been washing their hands. They wear masks during breastfeeding. We have not separated the unit because the benefit is greater for both of them from a bonding process and from the psychological, the emotional attachment to their newborn life. So we really try and make it a holistic experience for them within the limitations of what the pandemic has dictated to us.
All right, Dr. Bhoora, thank you for giving us your time. We appreciate it very much, and thanks indeed for the work that you're doing there at Charlotte Maxeke Hospital. Thank you. All right, that's Dr. Shastra Bhoora, from the head of the COVID team for Obstetrics and Gynecology at the Charlotte Maxeke Hospital in Johannesburg. Do stay with us. Your headlines at the top of the hour.